Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the most common primary salivary gland cancer? Answer: mucoepidermoid carcinoma. Question: what demographic of women are more commonly affected by cervical carcinoma? Answer: middle ages, 40 to 50 years old. Question: which age group is commonly affected by follicular lymphoma? Answer: adults. Question: how does cellular pH change in cellular injury? Answer: decreased pH. This is due to the failure of aerobic glycolysis and the resultant switch to anaerobic glycolysis, causing a buildup of lactic acid. The decreased pH denatures proteins and precipitates DNA. Question: which cytokine from Th2 cells promotes B-cell class switching to IgE? Answer: IL-4 and IL-13. Question: which pathologies are associated with basophilic stippling of Rbcs? Answer: thalassemia, anemia of chronic disease, and lead poisoning. Question: what translocation is involved with Ewing's sarcoma? Answer: T1122. Question: what do the IgG autoantibodies in multiple sclerosis target? Answer: potassium channels on glial cells. Question: what is the most common type of nephrolithiasis? Answer: calcium oxalate and or calcium phosphate, 70%. Question: which type of osteoporosis is senile osteoporosis? Answer: type 2. Question: which sinus is typically affected in rhinosinusitis in adults? Answer: maxillary sinus. Question: what is the morphological hallmark of irreversible cellular injury? Answer: membrane damage. Question: which cancer is associated with chromium? Answer: lung carcinoma. Question: what tumor suppressor does the E7 protein from human papillomavirus, HPV, bind to and inhibit? Answer: Rb. Question: what form of antineutrophil cytoplasmic antibodies is located in the cytoplasm and yields fluorescent cytoplasm? Answer: CANCA. Question: what antibody is involved with allergic rhinitis? Answer: IgE. Question: what is the etiology of gastroesophageal reflux disease in obese patients? Answer: increased abdominal pressure. Question: which age group is commonly affected by Burkitt lymphoma? Answer: adolescents, young adults. Question: how does total lung capacity change in restrictive lung disease? Answer: decrease. Lung expansion is decreased, hence lung capacity decreases. Question: which pattern of necrosis is characteristic of pancreatitis? Answer: liquefactive, proteolytic enzymes from the pancreas liquefy the parenchyma. Question: where do osteomas commonly arise? Answer: on the surface of facial bones. Question: what level of visual impairment can detect hand motion? Answer: 20 to 500 to 20 to 1000. Question: what type of glomerular immunofluorescence is seen Churg-Strauss syndrome? Answer: pauciimmune. Question: what class of anemia are all hemolytic anemias? Answer: normocytic. Question: what is the treatment for polymyalgia rheumatica? Answer: low-dose corticosteroids. Question: which congenital infection is associated with cardiac septal defects? Answer: congenital rubella. Question: which neoplasm is associated with chronic atrophic gastritis? Answer: gastric adenocarcinoma. Question: what is desmoplastic tissue? Answer: fibrous tissue made in response to neoplasm. Question: where do osteomas commonly arise? Answer: diaphysis cortex of long bones. Question: what is the most common oral cancer? Answer: squamous cell carcinoma. Question: what is the primary function of IL-5? Answer: attraction of eosinophils. Question: which artery is commonly affected by a ruptured gastric ulcer, especially on the lesser curvature of the stomach? Answer: left gastric artery. Question: which type of fetal growth restriction involves a symmetrical growth restriction? Answer: fetal, aka proportionate FGR. Question: how do haptoglobin levels change in intravascular hemolysis? Answer: decreased. Question: which pattern of necrosis is described as necrotic adipose tissue with a chalky white appearance due to deposition of calcium? Answer: fat necrosis. Question: what is the etiology of hyper-IgM syndrome? Answer: mutation in CD40L on helper T cells or CD40 on B cells. Question: which lobe is the most common origination of focal, partial seizures? Answer: medial temporal lobe. Question: what gene is involved in inherited neurofibromatosis 1 and 2? Answer: NF1 and NF2. Question: what is myopia? Answer: aka short-sightedness, Light rays focus before the retina, eyeball is too long. Question: what is the risk of progression to invasive carcinoma of lobular carcinoma in situ? Answer: low. Question: what is the most common cause of acute rhinosinusitis? Answer: viral upper respiratory tract infection. Question: what is a colorless nitroblue tetrazoleum test indicative of? Answer: an DPH oxidase defect. Question: what translocation associated with cyclin D can cause mantle cell lymphoma? Answer: T1114, to Ig heavy chain. Question: what is the most common etiology of mesothelioma? Answer: asbestos. Question: what is the treatment for kernicterus physiological jaundice of the newborn? Answer: phototherapy, breakdown down UCB and makes it water soluble, does not conjugate UCB, but allows it to be excreted via urine. Question: which Wilms tumor syndrome is associated with the deletion of the WT1 tumor suppressor gene? Answer: Wager syndrome. Question: which cardiac chamber is most commonly affected by myxoma? Answer: atria, 90%, typically the LA. Question: which inflammatory mediator trigger P-selectin upregulation from Weibel-Palade bodies? Answer: histamine. Question: which type of hyperparathyroidism is associated with hyperphosphatemia? Answer: secondary. Question: atherosclerosis can cause stenosis of medium-sized vessels. What pathology occurs if this happens at coronary arteries? Answer: angina. Question: which bacteria has a strong suggested linkage to atherosclerosis? Answer: Chlamydophila sp. Question: what is the treatment for Wilson's disease? Answer: D-penicillamine, a copper chelator, or trientine. Question: which complement protein is chemotactic for neutrophils? Answer: C5a. Question: what receptor does trastuzumab target? Answer: HER2 Neu. Question: which mixed platelet and coagulation disorder is associated with nephrotic syndrome? Answer: disseminated intravascular coagulation. Question: how do creatine kinase levels change in dermatomyositis and polymyositis? Answer: increased. Question: which type of hyperparathyroidism is associated with increased cyclic adenosine monophosphate in the urine? Answer: primary. Question: how does the risk of endometrial carcinoma change in polycystic ovarian disease? Answer: increase. Due to an increase in estrogen levels from the aromatization of testosterone and absence of progesterone. Question: how is cluster headaches differentiated from trigeminal neuralgia? Answer: duration. Trigeminal neuralgia is in the distribution of CNV and lasts less than 1 minute. Cluster headaches typically last greater than 15 minutes. Question: which gender is more commonly affected by autism spectrum disorder? Answer: boys. Question: what cancers is associated with HTLV1? Answer: adult T-cell leukemia, lymphoma. Question: what is the most common type of specific phobia? Answer: animal. Question: which adrenal glands are atrophied in Cushing syndrome caused by exogenous corticosteroids? Answer: both, due to exogenous suppression of adrenocorticotropic hormone. Question: what is the second most common type of ovarian tumor? Answer: germ cell. Question: what is the most common cause of death in adults with sickle cell disease? Answer: acute chest syndrome. Question: what age group is more commonly affected by fibromyalgia? Answer: 20 to 50 years old. Question: what is the most dangerous/reactive free radical? Answer: hydroxyl. Question: which tumor is associated with PDGFB overexpression? Answer: astrocytoma. Question: which type of nephrolithiasis is aka struvite stones? Answer: ammonium magnesium phosphate.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.